So as you know, in the last decade, we really observed a significant increase in the incidence of early onset colorectal cancer. So cancer of the colon diagnosed before the age of 50, so in the pre-screen, before the age of the classical screening. A couple of years ago, at the EORTC, the European Organization for Research and Treatment of Cancer, we established an adolescent and young adult gastrointestinal cancer task force with the aim of exactly trying to understand this phenomenon and trying to explore the different rates of incidence in early onset colorectal cancer across Europe. Together with the IDEA collaborators in the IDEA meta-analysis that previously studied 3 versus 6 months of adjuvant chemotherapy, we highlighted how early onset colorectal cancer patients with a high risk stage 3 tumor have actually worse outcomes compared to later onset patients, despite the fact they actually receive more treatment. So this clearly triggers a biological question, whether there is a different biology of this patient compared to what we've seen in a standard colorectal cancer patients. Recently, in collaboration with our Genospace, which is our genomic platform in the US that collects genomic reports across all our subcanon centers, we were able to compare the genomic profile of early onset colorectal cancer patients and later onset. And we confirmed actually what was already established from premier researchers, that at the genomic level, there is not a macroscopic difference between these patients, with the exception maybe of a few genes that might be related to genetic risks. So that tells us that it's possible that this biological difference might be driven by different mechanisms, maybe in the transcriptional factors in the RNA space or in methylation. So we are currently investigating this across Europe.